Now what we have here, albumins. So albumins are the most abundant blood protein. We did cover it very briefly when we talked about blood in chapter 18 in OpenStax, chapter 19 in Martini. But this contributes to the majority of oncotic pressure. This is why albumins are super duper important. And they're produced by the liver. And your liver, it's kind of funny because your liver does so much for your body. And if you have liver failure, guarantee if you don't get a liver transplant, or you don't, your livers or all the other organs in your body are going to shut down. The thing is that your liver does so much for all the organs. I think your book shunts the liver to the digestive system, but it's also very important in maintaining your blood volume and cardiovascular system and your immune system and your clotting and so many other things. But I'm getting on a rant here. So what we have here is human albumin, and sometimes this is given as a medication or in medical treatment. So what we have here, we have blood and our interstitial fluid, right? So to recap our previous slides, you have capillary hydrostatic pressure moving water from your blood to your interstitial fluid, right? Because again, that heart is pumping, generating pressure, and therefore, with all that blood pressure, you move water from the blood into the interstitial fluid. Now, with your liver produces these albumins, and albumins are proteins that contribute to oncotic pressure. So as your liver cranks out these albumins, what is it going to do? It's going to generate oncotic pressure, which contributes to BCOP and draw water back into your blood. So this is why albumins are super important. If you didn't have them, what would happen? Well, that's what we see in liver failure. So liver failure is when your liver can't perform its functions. It could be due to things like hepatitis or due to things like the cirrhosis of the liver. So if something is affecting your liver's health, your liver isn't going to be able to perform its normal functions. So one of the many functions of your liver is to produce serum albumins. So if your liver is some diseased and unhealthy and unable to produce these albumins, what happens to the albumins in your blood? If your liver is out of the equation, so are these albumins. So if you have decreased albumins, what happens to the albumin concentration in your blood? It drops off. If the albumin concentration in your blood drops off, you have decreased proteins in your blood, and therefore you have decreased BCOP. So what we said, and the thing is that even if your liver is failing, you still have your heart pumping, you still have capillary hydrostatic pressure, right? But with this capillary hydrostatic pressure, you have it move fluid filtering from your blood into your interstitial fluid. But if you have a lack of albumins, what's going to bring it back? Yep, you're going to get less reabsorption of water, right? So with no BCOP to bring the water back, you're going to have this fluid building up into your interstitial fluid. So this leads to two terms. And what happens if you don't bring that fluid back into circulation? You can develop edema or ascites. And edema is a general term referring to abnormal gathering fluid in tissues. And ascites, what we see here, this person is not adipose right here. This is actually fluid swelling what we call the peritoneal cavity of the abdomen. So what we have here is all this fluid should be brought back into the circulation is actually filtering out of these blood vessels and staying in the tissues instead of actually being brought back into your blood vessels. And this one is actually more specifically called pitting edema. So what this happened is someone was poking these tissues, and this is why their imprints are staying there, because due to that fluid imbalance and gathering, due to the failure of your cardiovascular system and the proteins and the BCOP to bring it back in, that's what we see here. Yeah, so much fluid. So this is one thing you can do this is one use of albumin. So albumin can actually be added to IV intravenous solutions. And what we have here, we have an IV bag, but we actually have albumin here on the side. So what we have here is that we have increased albumins. Therefore, so if you have liver failure and your patient has a lack of albumins, you can bring their albumins back up by supplementing with these albumins and bring their BCOP back up. By bringing their BCOP back up, now that draws water back into your vessels, so more water reabsorption, So this is one possible use of serum albumins. Now, is it always used for this? It can depend on the patient. Like you have to look at other things like their other electrolytes and other conditions. But this is one way you can treat a lack of BCOP. Yeah, so does it help with getting rid of abdominal fluids? Yeah, so there's various ways of getting rid of abdominal fluids. Sometimes they could do the direct draining, like they can actually do a paracentesis and yeah, drain the fluid itself. But yeah, that's what I'm getting at here is that this is why your albumins are super important. Okay, so what we have here is circulatory shock. So circulatory shock, or sometimes simply called shock, is basically when your circulatory system isn't able to pump enough blood and supply your tissues with blood. So if you have lack of blood flow, this is shock. But hypovolemic shock, this is a type of shock caused by, so hypo, remember, if you have like normal, hypo means below, right? And volemic refers to volume. So what you have is a below volume shock. So it's talking about what if you don't have enough blood volume in your body. So it's kind of like to bring back our hose analogy, well, if you've ever lived in an apartment building or a dorm and the water pressure in your building goes out, can you turn on your faucet and get water? Not really, right? So if you have a low volume and low flow, this is not going to provide adequate supply to where it's needed. So hypovolemic shock, if you don't have enough blood volume, you don't have enough pressure. And remember, flow equals pressure over resistance, right? So if you have a decrease in pressure, you're going to have a decrease in flow. So what's one way to solve hypovolemic shock? Bring fluids back in. So typically you would introduce things like, this is why you might do a blood transfusion, a plasma or you might sometimes introduce just a normal saline IV bag, but say your patient's sodium levels are already kind of high. So that's why if you look at this one here, it says low salt. So sometimes if a patient has hypernatremia and too much sodium, maybe you might want to use IV with a low sodium IV with albumin supplemented, so you don't introduce too much sodium. But so that's why sometimes it's like a second line treatment.